The state has even started a vaccine series as Ohio added another 4,300 new COVID-19 cases yesterday, which is much lower than the 21-day average.
And it seems misinformation about the vaccine is everywhere, and sometimes it can really be difficult for people to tell the difference between fact and fiction.
With the COVID-19 vaccine now available to some members of the general public, healthcare experts want to make sure everyone has their facts straight. So Meg Shaw is live this morning to help us dispel some vaccine myths this morning that's been roaming around. So set us straight, Meg.
Well, Danita and Katie, I mean, it is clear there is so much information and misinformation on social media that it really is tough, because you may have read that the COVID-19 vaccine isn't safe, or that it causes fertility issues in women, or that it goes in and messes with your DNA. Well, we talked to an expert who tells us none of that is actually true.
In the information age, it's so easy to pass something on with the click of a button. So it's no wonder how misinformation can spread like wildfire. We spoke with university hospitals about some of the myths being shared online, like the one where the vaccine will affect a woman's fertility.
In the vaccine studies, there were over 25 women who became pregnant after they had gotten the vaccine, and there was one miscarriage, and that was somebody who had gotten the placebo, not the vaccine.
Dr. Robin Strosaker says while there hasn't been a study specifically looking at pregnant women and the COVID vaccine, there is one thing we know for sure.
The risks of contracting COVID when you're pregnant are not insignificant. You know, you're in a state of relative immune compromise when you're pregnant, and we know that pregnant women can get more ill with COVID.
She says it's best if women talk it over with their doctors. Another myth floating around social media, that the vaccine will enter your cells and change your DNA. Well, that's another falsehood according to Dr. Strosaker.
Vaccine does not change your DNA. In fact, it's what's called an mRNA vaccine. So it does go into cells. It does not go into the nucleus of cells or the center part of cells that have the DNA. All it does is go into the cells enough to produce these proteins to allow you to become immune.
Worried the vaccine was rushed and might not be safe? Turns out the RNA delivery system has been in the works for a while.
This was technology that has been in development for literally decades. So this wasn't something there would have been no way we would have had vaccines as quickly if folks had started from scratch. This is something that's been in the works for a long time.
Maybe you're sold on the vaccine and you can't wait to get that second shot so that you can walk the world mask-free at last. Well, not so fast. That's another myth.
What we don't know yet is whether or not the COVID vaccine prevents you from spreading COVID. So even after the vaccine, you could be exposed to COVID, be completely asymptomatic, and if you don't have your mask on, you could continue to spread that virus to somebody who may not yet be immune.
So be patient. Give healthcare workers time to bring our case numbers down and get the country up to herd immunity.
So let's just all keep wearing our masks, get our vaccines, and we can all be done with this crazy pandemic.
So if you become eligible for the COVID-19 vaccine and are wondering where you can go to get one, we have all of that information for you right now on our News 5 app and news5cleveland.com. Reporting live, I'm Meg Shaw on News 5.
Thank you.